Governor Andy Beshear will join state health officials to mark 5 years since the first COVID case was diagnosed in Kentucky and honor the lives of the more than 20,000 Kentuckians who were lost due to the virus.
While we know a little bit more about COVID-19 and how manageable it can be now, it is not gone, and it is still a very serious illness. I sat down with an infectious disease specialist from Norton to discuss where we're at today.
We are announcing that Kentucky has its first confirmed case of the coronavirus.
A once-in-a-generation disease lands in the Commonwealth.
Many people thought it would be flu, not a coronavirus.
A pandemic, the likes of which we hadn't seen since the Spanish flu in the early 1900s.
There was always maybe this thought that, okay, but not now. Maybe not in my lifetime. Not for a while. Yes, it can happen. Yes, we need to be prepared.
COVID-19 spread into America in January 2020 with the first reported case in Washington state. Within weeks, on March 6th, came the first case in Kentucky. Dr. Chris Bryant is an epidemiologist at Norton Children's Hospital and serves as Associate Medical Director for the Department of Public Health and Wellness. She says by the time the first Kentucky case was confirmed, she and her team were already making plans for the inevitable.
We were looking for cases, we were thinking about it, we were testing people, and we were preparing. When the first stories came out of China about people having an unusual viral illness, did I think it would turn into a worldwide pandemic? No.
Despite the preparation, the pandemic hit, and hit hard. Between March 2020 and July of 2024, more than 1.7 million Kentuckians were infected with COVID-19. Dr. Bryant says the pandemic put a spotlight on public health and how they work, which isn't always straightforward.
Over the course of the pandemic, we locally, public health officials across the U.S. and across the world had to make decisions with sometimes limited data, and then we would learn more, and we would need to modify those decisions to better protect people.
Flash forward to 2025, and the threat of COVID-19 is not what it was, despite the discoveries of new variants. Many people have baseline immunity, vaccines that help protect against serious illness, and procedures in place to help prevent the spread. While no one can predict when the next viral pandemic could happen, this generation has now been there before.
Do you think we're more prepared today to handle an outbreak of a novel kind of virus as opposed to 5 years ago?
Oh, I think so.
Dr. Bryant says that COVID vaccines are updated for current variants, and just like the flu shot, it is effective at preventing severe disease and death. Today's ceremony with Governor Beshear will start with the chiming of the bells. He asked Kentuckians to do that every morning during the pandemic to support those who were feeling alone. State officials will also speak. That ceremony is set to begin at 3 o'clock this afternoon at the Capitol.